Warning: watch this video or you will regret it. Elderly people are tired, have poor appetite, forgetfulness, sleepiness. Many people often think that these are just normal signs of old age. But hidden behind these symptoms, there may be thyroid disease that is silently destroying health. The thyroid gland, small gland located in the neck, controls a series of vital functions such as metabolism, heart rate, energy, and memory. In the elderly, thyroid disorders are easily overlooked because the symptoms are vague, easily confused with weakness due to age. And it is this subjectivity that causes many people to only discover the disease when there are dangerous complications. In this video, let's learn about thyroid disease in the elderly, a seemingly harmless, silent killer. What is the thyroid gland and its role in the elderly? The thyroid gland is a butterfly-shaped endocrine gland located in the front of the neck, just below the larynx. Although small, the thyroid gland plays an extremely important role in regulating energy metabolism, controlling heart rate, body temperature, brain activity, and the digestive system. It secretes two main hormones, T3, triiodothyronine, and T4, thyroxine, the conductors that coordinate all metabolic activities in the body. In the elderly, the aging process makes the thyroid gland more susceptible to disorders, either overactive, hyperthyroidism, or weakened, hypothyroidism. When its function is unstable, the thyroid gland slows down or speeds up a series of body functions. This imbalance greatly affects the health of the elderly, from the cardiovascular system, digestion, to memory. However, the special thing is that in the elderly, the symptoms are often atypical. For example, instead of shaking hands and rapid heartbeat like young people with hyperthyroidism, older people may only feel tired and lose weight slightly. Or when suffering from hypothyroidism, they are prone to drowsiness, mild depression, increased cholesterol, which can easily be confused with normal fatigue due to old age. Therefore, recognizing the role of the thyroid gland and the importance of regular thyroid function testing is the first step to avoiding the silent consequences of this disease. Common thyroid disorders in the elderly. There are three common thyroid disorders in the elderly: hypothyroidism, hyperthyroidism, and goiter, benign or malignant. Hypothyroidism is a condition in which the thyroid gland does not produce enough hormones, leading to slow metabolism. Elderly people with hypothyroidism often have very vague symptoms: fatigue, dry skin, hair loss, constipation, drowsiness, mild depression, forgetfulness, and slight weight gain. Because these symptoms are similar to the normal aging process, many people do not go to the doctor, causing the disease to last and silently cause harm. On the contrary, hyperthyroidism is a condition in which the thyroid gland is overactive, causing excess hormone production. In the elderly, hyperthyroidism often does not have typical symptoms, such as hand tremors, rapid weight loss, but only appears as rapid heart rate, palpitations, anxiety, difficulty sleeping, muscle weakness, and easy falls. This condition is especially dangerous if not detected promptly because it can easily cause arrhythmia and stroke. In addition, the elderly can also have goiter, an enlargement of the thyroid gland or the appearance of tumors. Most goiters are benign, but a few can be thyroid cancer, especially when there are signs such as prolonged hoarseness, difficulty swallowing, and hard lumps in the neck. Understanding the different types of diseases helps us not to be subjective to small changes in the body and can be examined and treated early to prevent complications. Consequences if not treated promptly. Thyroid disease, if not diagnosed and treated promptly, can lead to many serious complications, especially in the elderly. When the body is already weaker, resistance is reduced and vulnerable. In the case of prolonged hypothyroidism, the metabolic rate slows down, causing high blood fat, which can easily lead to atherosclerosis, high blood pressure, and the risk of myocardial infarction. In addition, the elderly are susceptible to memory loss, confusion, and even severe depression, which is sometimes mistaken for senile dementia. On the contrary, untreated hyperthyroidism can cause the heart to work too hard, causing arrhythmia, heart failure, or stroke. Patients are also susceptible to osteoporosis, bone fractures, and psychological disorders such as anxiety or agitation. With malignant thyroid tumors, if detected late, they can metastasize to the lungs, liver, bones, and are very difficult to treat completely. Even if it is a benign tumor, if it is too large, it can cause difficulty breathing, swallowing, and affect the quality of daily life. Worryingly, many elderly people consider these signs as normal, thereby ignoring the golden period for effective treatment. Therefore, never be subjective to symptoms such as persistent fatigue, rapid heartbeat, unusual mood swings, because it is very possible that the thyroid is calling for help. Early detection and effective treatment. To detect thyroid disease, simple tests such as checking the levels of TSH, T3, and T4 hormones in the blood can show whether the thyroid is functioning normally. If there is a tumor, the doctor may order a thyroid ultrasound or a biopsy to assess the nature of the mass. Treatment depends on the type of disorder. For hypothyroidism, the doctor often prescribes levothyroxine hormone replacement to compensate for the hormone deficiency. The dose must be carefully adjusted, especially in the elderly, to avoid overdose, which can lead to hyperthyroidism. For hyperthyroidism, the treatment may be antithyroid drugs, radioactive iodine, or thyroidectomy. In the elderly, the doctor will carefully consider to choose the appropriate method with the least risk. If a benign goiter is detected, sometimes only periodic monitoring is needed. But if it is thyroid cancer, surgical removal combined with radioactive iodine treatment may be indicated. Most importantly, older adults need regular health checkups, especially if there are suspicious symptoms or a history of thyroid disease. Early detection makes the disease easier to control, reduces treatment costs, and prevents dangerous complications. In the elderly, thyroid disease is not noisy, not fierce, but it is a silent destroyer of health every day. Signs that seem normal, such as prolonged fatigue, rapid heartbeat, sleep disorders, or mood swings, are easily overlooked because they are thought to be inevitable consequences of old age. But the truth is, the thyroid gland may be functioning abnormally and silently, causing a series of dangerous complications for the heart, brain, and skeletal system. Don't let subjectivity lose the opportunity to detect and treat promptly. Listen to your body, have regular health checkups, and consult your doctor when there are any unusual changes. If you find this video useful, click like, leave a comment sharing your thoughts, and subscribe to the channel to continue accompanying us on the journey of taking care of the health of the elderly every day.